Welcome to Educate, Agitate, Organise Saturday. My co-host this week is Cathy Augustin, who, as well as being the Secretary of Don't Leave Organise, is also the Chair of Keep Our NHS Public Oxfordshire, and also a member of Keep Our NHS Public's National Executive Committee. Really great to have you here, Cathy. I'm really pleased you can be the co-host because tonight's programme is really important. It's all about the pay offer, the measly pay offer from this government to our NHS workers.
Yeah, well, it's great to be here anytime, but particularly around these issues that you've just highlighted, Matt. Really looking forward to hearing from our frontline workers, shining a spotlight on grassroots campaigns, and actually what it's really like on the front line in the NHS now. And I expect that to be quite a harrowing and shocking description.
So as you know, this programme is all about shining a spotlight on vital campaigns, workers organising up and down the country. Really pleased to have our two guests on this week. Without further ado, let's go to the interview. There are few people who understand the impacts of the COVID crisis as acutely as our frontline workers in the NHS. The NHS has been run down after more than a decade of austerity and cuts and so-called efficiency measures that just add to the workload of our vital frontline staff. We've seen the hypocrisy of us being asked to clap for carers during the height of the crisis, but now we see, when it comes to setting a budget, the Tories have offered a measly 1%, which, when we factor in the 10-year pay freeze and inflation, in real terms is a pay cut. I'm really privileged to be joined this evening by two workers from the sector. Alison Brown, who is, as well as being a paramedic, she's an area secretary for the Unison Yorkshire Ambulance branch, and also John Ingleson, who is, as well as being an ODP in operating theatres, he's the chair of the Unison Leeds Teaching Hospitals. Thanks for joining us, John and Alison. Really pleased to have you here. Before we get into the details of this 1% pay offer, I think it's important that we understand the context of the state that the NHS is in after 10 years of Tory stewardship. Alison, I wonder if you could talk about that a bit.
Well, I've worked in the ambulance service for a good while, 20 years, and I would say in the last 5 years, the workload has, really been noticeable, that we've really been massively under pressure all the time, particularly in winter. Obviously, it's relentless, and that's, that was before we went into the crisis. So the workload has massively increased, the stress has massively increased, and I think part of that has been because the cuts in local authority services and other health services has meant that when there's shortages there, people turn to the emergency services. So from an ambulance service point of view, that's meant a massive increase in our workload.
And that's kind of fundamentally a stealth cut, isn't it? That's not instead of cutting the NHS directly, it's cutting local authorities.
Exactly. So one of the most obvious things has been around mental health services, that, the provision's just not there for people. And so they, they're in crisis, and so they call us. And so,
John, I mean, David Cameron had the audacity to say that because of his austerity measures, he'd future-proofed our public services to deal with the COVID crisis. And that's demonstrably false. I wonder if you could, what's your experience been?
Well, I think you're looking at cutting the bursary, cutting education fees for student nurses and other allied health professionals. That's left a real gap. What we're really seeing now, that's not immediately obvious, is it? Because you've got your established workforce. But if you keep cutting and cutting and cutting, you're then left with the bare bones. And certainly the last few years have been far busier, far more pressure on the front line in clinical settings because we've got less staff coming through, and the staff who are there are tired.
And we talked a bit about before we started recording about the impacts of. Well, first of all, I mean, I think talk us through. I mean, I'd be really interested to know. I mean, I think everyone saw really harrowing photographs of health workers with, you know, they've been wearing PPE for hours at a time and the impact it had on their face. And it obviously wasn't just a physical impact, you could see it in their eyes. I wonder, John, if you could just talk us, you were talking about it a bit before, if you just sort of tell us a bit about that.
Yeah, it's exhaustion. You wear full PPE for a long time. It is, you know, you're not drinking that time, you're not going to the toilet, you're hot, you're uncomfortable. You're anxious while you've got that PPE. You're in a state of high alert, aren't you? It knocks it out of you. It really does. And you know, I know we'll go on to the 1%, but during that time, you think, you know, we're going above and beyond here. We're working in very uncomfortable conditions, and you're hoping, oh well, there will be some reward at the end of this. We're doing this in the short term, and you know, to come at the end of this year, it's basically a year exactly, isn't it, since all this started in the UK, to say this 1% pay cut is on the table. That's not what people spent 12 hours in PPE for.
Yeah, Alison, I wonder if you want to comment on that.
Yeah, I mean, in our jobs, we can't stay socially distant from people. You know, we are close up. So, you know, in terms of the assessments and the treatment we give, we have to be close up to people. And these are people which in many cases are, you know, we know have got COVID. So in PPE, that many of us have felt has been inadequate. So, you know, we have been at the forefront of putting ourselves at risk of COVID, and most of my colleagues have had COVID. Some of those people have been severely affected. Some people have died. Some people have been in intensive care. Some people have long-term COVID and long-term health issues because of contracting the disease. So, you know, that's the risk that people have had to face on a daily basis just because it's their job to do that. And, you know, some people have had COVID and recovered well, but that constant risk that's there has obviously taken its toll on people. And, you know, we've noticed it just in relationships at work. You know, it's just that little bit more fraught, really, I think. And
it sounds like there's as well as obviously there's the long-term impacts of COVID itself, which we still don't really clearly understand in detail. But it sounds like there's we're saving up a real. There's already, it sounds like, a mental health crisis in the profession, in the sector. But it sounds like we are really building problems down the road. Is that? Would you say?
Yeah, I do worry, Matt. If and when things do settle, hopefully this summer we might have a period where things are a little easier. That dump of adrenaline's got to be huge throughout the health service, throughout everybody who works in health and social care, as Ali rightfully says, in care homes and in the community and what have you. You know, people have knuckled down and done. When you go back to your normal workplace and life becomes normal, I think the reality of what we've just been through has got to hit people. A lot of trusts can put mental health services in place, and there's opportunities to talk, and my trust have got things in place, and it's been really good to be able to have that resource. However, I'm convinced there's got to be a real hole in staffing numbers in the summer when people look back and reflect and will crumble. I'm sure they will.
And that's not helped at all by this pitiful pay offer.
I think the shortages, you know, 100,000 vacancies in the NHS before we've even started. And then you're going to have people who have kind of come through this and feel that they haven't got any more to give, really. You know, fatigue, compassion fatigue. And, you know, they'll think, well, that's me done now. So I think you will have people leaving post-crisis, and those vacancies are going to be more and more apparent. And, you know, really the way that you fill vacancies is by making the terms and conditions better and making the pay better. And the Tories are doing the exact opposite of that. So, you know, it's cutting at the heart of the NHS, really.
And that's fundamentally it, isn't it? I mean, this is about how the government acts as custodians of the NHS. I mean, they love to say there's no magic money tree, right? Which is, I mean, let's leave that to one side for the moment. But even if that were the case, then that would somewhat imply that there's kind of either ors for things, isn't there? Now, we know that they have, and I think it's safe to say, squandered an absurd, a criminally absurd amount of money on test and trace, which we don't even really talk about anymore. Other than Grant Shapps saying we would have been in a really much worse place without that system in place. I mean, we could have sent about 10 missions to Mars. This is Jeff Bezos money. This is mad. And they have money for that, but they don't have money to look after the people who looked after us, who looked after the people we care about. What does that say? This is provocation, isn't it?
Yeah, it is exactly. It's exactly that. It's provocation. They've not liked that public services have had this big platform throughout the last year that we've been on the front page of newspapers. We're getting praise saying the NHS is, all the hero stuff that I'm not really comfortable with. But public services have they've proved their worth over this last year. The Tories don't want that. They want the focus to be on private industry, and private industry is what how society runs. When it came down to it, as public services who stood up, isn't it? And they don't want that. That provokers to try to turn the public against us, greedy nurses, or at least they've got jobs. It's got to be provocative because I don't know what else it is. As you say, there's been plenty of money for other things.
Alison, what are your thoughts?
Well, I think that this year has been evidence, if you ever needed it, that the health service, good public health provision, and public services, in other words, measures to challenge inequality, are essential to society and to the economy, our economy and their economy as well, actually. That these things are not separate. If you don't have a basic healthy society, you're not going to have a thriving society. So it's, this division between private and public and economy and health is just completely false. And this year has proved that. It's proved it fundamentally. And I really think we have to, have that argument and talk to people. We're not just asking for a pay rise because we've done a really good job. We're asking for a pay rise to save the NHS for the wider community, as well as because we've done a good job.
And people who work in the NHS spend their money in our economy. This is the thing. It wouldn't be extractive to give you people more money. That money would go into the economy. You've got to buy food, you've got to pay your rent, you've got to pay your mortgage. I think we should also talk as well, of course, we're not just talking about health workers. I mean, nurses and doctors get a lot of headlines, and paramedics as well, obviously, but there's lots of other people, there's lots of other workers in the NHS as well, and this impacts them as well. I wonder if we could talk about that a little bit. The impacts have been felt across the NHS. Obviously, a lot of people who normally work in, different roles in the NHS have gone frontline. So that's one aspect to this, is that people who have been in, all different sorts of training roles have come into the frontline during the pandemic. But the increased workload and the stresses impacts throughout, and cleaning staff have been at the absolute forefront of making sure we've got safe environments. The impact has been felt across the board. So I'd like to. Yep. Sorry, John, go on.
No, exactly what Ali's saying. Obviously it's nurses will get the headlines and healthcare professionals. It's just the nature of the beast. But we wouldn't be able to do our job at all without porters, cleaners, all the estate staff who managed to reconvert wards and what have you. They're doing that in hot areas, with those risks, especially on the first wave. We didn't know what the virus was. We didn't know the ramifications. What do you take home to your family? They were there with us all the way. And it's easy to say nurses, but it is every single person who works within that hospital, within that community, within that care home.
So what do we do?
Fight. We can't take it laying down. We can't just say, okay, 1%, or we'll settle for this, we'll settle for that. We need to get our message out there that if we tolerate 1%, one, it's a slap in the face to people who've been doing the job. But as Ali says, it's the future workforce. How are we going to recruit people to fill these gaps? What NHS will exist in 5 years' time if the people who've been through this pandemic slowly drop away and nobody new comes into the professions and into the hospitals and care homes?
Ali?
Well, there's already been, protests organised, and I think we have to carry on doing that. At the weekend, obviously, there was a fine put on a Unison activist who'd organised, a socially distant, very safe and well-managed protest. But I think we have to carry on organising protests within COVID measures, safe protests, and the public can back us in that. They can join those. But I think we have to start organising across the unions as well. Quite often in the health service, there's kind of competition between the trade unions. I think that's got to be set aside, and we've got to all work together as we lead up to the pay review process. We've all got to work together to say that 1% is not enough. Health workers say no are campaigning for 15%, and I personally support us campaigning for that. But we certainly need a pay settlement that will address the 10 years of pay reductions that we've had. I don't think, the Tories could come back and say, oh, OK, we'll give you 2%. To me, that's not enough. We have to work together to fight for a decent pay rise for all health workers.
And that just, and so people understand that am I right in thinking the 15% number, that comes from when you take into effect the pay freeze of the last 10 years, is that?
Yeah, that's right, yeah. I mean, the government are simply lying about the amounts that they're saying we've had in pay settlements. They take the pay deals we've had over the last 3 years. It was quite a complicated settlement, and they take the most beneficial version of that and not even look at it in real terms when they're lying about the settlements that we've had over the last few years. We've had pay cuts, same as everyone else. 15%
just takes us back to where we was 10 years ago. It's nothing, the figures are out there. They're out there. It's, we've had, as Ali says, year on year cuts all the time. And sometimes there've been freezes, sometimes there've been little pay rises, what have not kept pace with anything. 15% is only asking us to go back to where we were 10 years ago.
So it's not even a pay rise. This is it. This is what people need to understand.
Really.
And I think as well, just the context of it. I mean, we did touch on it. I think we probably should talk about privatisation in the NHS because the Tories like to say it's safe with them, but I mean, well, let's look over the Atlantic. I think there's something like 500,000 people have become bankrupt because of medical debt during the COVID crisis in the States, and that's what they want to bring over here at the end of the day. I wonder if Ali, could you talk us through that a little bit?
Yeah, I mean, I think that the way that privatisation has affected the NHS in this country at the moment is through a lot of services being contracted out to the private sector and, just the fragmentation of the service. So the health workers that work in those bits of the health service are not even affected in general by this pay claim. So we've got lots and lots of people, and that includes people working in social care who are not being offered any, not even being offered 1%. So, I think as well as looking at our pay, we need to be looking at insourcing, those workers back into the NHS, and them, if that's not possible, then them fighting for parity of terms and conditions to us, like the SAGE workers are doing in the care home strike in London at the moment. We have to all the time, I think, be talking about those workers that, 10 years ago would have been NHS workers that aren't anymore.
And I think that's it's the choices couldn't be starker, could they? I mean, we talked about the people who are burning out, and I think justifiably so, with the profession, and thinking, well, look, I mean, the government's treating me like the enemy, and is really sort of continuing to attack paying conditions. This is an increasingly dangerous job because of COVID. And that could lead to a complete collapse, and we end up with something like the insurance system they have in the States and all the consequences of that. The alternative to that is properly paying, not just a decent dignity wage, I think, to the people who've got us through this crisis, and actually properly funding services as public bodies for a public good. Because it's clear as well, I mean, the conditions that created COVID, they haven't changed. We could very well have another pandemic in the next 2 years, 5 years. You know, we just don't know, do we?
Well, we do. I mean, we do know. We knew before this pandemic, we knew, because they've been, you know, the experts have said for a long time that we could expect it. And what the experts now say is that the environmental conditions that led to this pandemic are likely to lead to another pandemic, you know, and that these things are going to become more regular. So, you know, we do know, and we should be preparing. And when you look at the inequalities that have been at the root of what, you know, I mean, obviously it's partly has been the government policies, but the inequality that exists in this country has been at the root of the reason why we have been so badly hit. And, you know, like you said, those things haven't changed. And actually the government is moving, you know, in the opposite direction. Social inequalities need to be addressed at the end of the day if we're not going to be so severely affected by future pandemics, which we know are coming.
I think for me, you know, as a rep in the workplace, the more support they can give you, your workplace reps, if you can, you know, amplify the message we put on social media, if you and have those conversations at home with people, there'll be a lot of rhetoric put out there by the press. As Ali mentioned, the Tory press will be talking about they've had a good pay rise last time and things like that. It's just to counter those conversations and say, no, it has been a 15 to 20% pay cut over the last 10 years. You've seen us going to work when nobody else was. You know, when you went to work within that first wave of the pandemic, there was nobody else on the streets, nobody at all. You know, there was the supermarkets and the hospitals and the care homes and what have you. That's the only people who go in there. And it's asking members who don't have much time, they're working a lot of hours as it is, but just making sure that they don't get swayed by lies, what have got to be out there. And it's our job to back them up doing that as well, and getting them information what says this is lies. And there's going to be much more of it to come. As you say, we've got to be framed as the enemy when we want more money and when we want to take hopefully some direct action to stop this.
Yeah, I think if you're a health worker, then make sure you join the trade union. Make sure that you get as active as you can do in your union. Speak to your reps, talk to your workmates. If you're not a health worker, if you're, you know, I mean, everyone is a user of the NHS, so you can get your voice heard from a patient point of view. You know, back any sort of protest that you see. There's petitions going round for, you know, against 1% and for a decent pay rise. Support those. And I agree with what's been said, that we are not pitting ourselves against people that work in the private sector. You know, we have been campaigning for safe workplaces in the private sector as well. You know, this isn't an us and them thing. This is, you know, us winning will be beneficial to, you know, across the board, I think, for workers. So, you know, don't believe when they're trying to divide us, don't believe those lies, really.
And so I hope you don't mind me asking this question, but you work really hard jobs, very unsociable hours, but at the same time, you're also really active and capable organisers in your sectors. I mean, what inspires you to do it?
What's inspired me is seeing my colleagues over the last year. I mean, seeing people going to work in tears, but still fronting up every day and turning up. I want to help those people, the fantastic, fantastic people. And that's not, as we keep repeating, it's not just nurses, it's all the support staff around there. You know, I want to do what I can within my role within the branch to big them up, get them the rewards they've clearly deserved. And, you know, I want to leave an health service and a public services for my children. As things are going, we've got to lose these things. I don't want my kids to grow up without a health service. I really don't.
Yeah, I think, you know, when I speak to my colleagues, then you see how you know, well they do their jobs, how much they put into their jobs, the stresses that are caused. You know, it's part of me to you know, to fight for that. And sometimes you just can't not do it, really. That's how it feels to me. You know, people are told that, you know, you have people like Boris Johnson making out he's an expert on things because he went to this Oxford or whatever. You know, no, the experts are the people I work with every day. You know, they're the people that I meet when I go into care homes. They're the people that know what's actually going on, and they're the people who have been at the forefront of pushing for the measures that are needed during the pandemic. You know, that's who knows, you know, how the best way to run our services are, and those people should be listened to. So, you know, just speaking up and saying what you think is always important.
That's great. Thank you so much, and thank you for everything that both of you do. Do you have any final message for our viewers?
I think my final message is to just be wary of what's coming. And 1%, I think that's pretty easy to say no to. And there's been talk today of, oh, well, they might get 2%, and 2% might have been discussed in Parliament. I mean, 2%, that's rubbish as well. You know, this is a significant pay rise we want, and it's a significant pay rise you should campaign for and fight for. And don't get swayed by that. And let's stick together, all the different unions, different colleagues, different grassroots organisations, all stick together and keep fighting and keep educating everybody around us who we can speak to at the moment.
Yeah, I can't do better than that, really. Stick together, don't believe the hype, don't trust the Tories. That's enough.
Fantastic. Well, listen, thank you so much to both of you. Really, really important to hear from really vital frontline workers and how this just atrocious pay offer is just such a slap in the face. Thank you so much. Hopefully we'll have you back again in the future to talk about how we won this battle to get you decent paying conditions. Thank you for joining me.
Thanks,
Matt.
Thank you.
So we've just heard from two excellent comrades on the front line in the NHS, and they made reference to a very recent protest. Now, I'm delighted at very short notice to be joined by Karen Reisman, who is a Unison rep. She's a health worker from Greater Manchester, and she's also one of the co-founders of People Before Profit. Karen, I'm so pleased to have you here. I wonder if you could just, I mean, for people who don't know, what happened with the protest that you were one of the organisers for?
My union branch, at very short notice, in response to the overwhelming sort of anger amongst health workers about the 1% offer, organised a small, very safe, socially distanced protest, fully risk assessed, on Sunday in the town halls, St Peter's Square in Manchester. And I was approached by the police a number of times while we were in the square, and we had a debate about whether or not, initially they said it was fine, and then they came back and said the sergeant says it's not. And I explained why I couldn't understand that, given that it was perfectly safe. And really, they weren't interested in whether it was safe or not. They didn't want to look at the risk assessment. They didn't want to discuss all the really strong precautions that we'd made. They just wanted to discuss the fact that they believed that it was unlawful under the COVID regulations. Eventually, I explained to the people there that this is what they were saying and this is what we were saying, and I was waiting for Silver Command to come back and to give a response to what I'd said. And they came back and said that their response response was there was no room for negotiation or for discussion. They wouldn't consider a very short protest, but they wanted us to close it down. So I spoke on the microphone again and thanked people for coming, thanked people for the protest, explained what the police had said, that they'd said that they would find me and they would also inform my employer and the NMC, the Nursing and Midwifery Council, and that in the light of that we were closing it down, and closed it down. I then did some press interviews. At the end of the press interviews, when the square was empty, they then asked me to come to one side and issued me with a fixed penalty notice of £10,000 for organising a protest of more than 30 people in contravention of the COVID regulations.
So just so I'm clear, so at the beginning you were told it was absolutely fine, and then when you were told it wasn't, you were complying. And
we were in negotiations, so I was explaining why I felt it was perfectly safe, and they were explaining why it wasn't about safety, it was about it being unlawful. And they then took it up to the sergeant, and we were waiting for the sergeant to get back. I spoke with the sergeant. He then said he would take it up with Silver Command, and I was waiting for Silver Command to make a final decision about whether they were accepting our arguments or whether they were going ahead and insisting that we shut it down. And so at the point when they insisted that we shut it down, we shut it down.
And so what's the response been?
Well, the response has been two responses, really. One is disbelief, absolute disbelief that a group of the police say 40 health workers in St. Peter's Square, completely socially distanced, should then be issued with a fine of £10,000. So disbelief at the fact that that happened in the first place, and then anger, real fury about it. And then the third response was an immense wave of solidarity towards me. So people who I don't know set up GoFundMe pages so that I didn't have to worry about the fine, and we've raised more than the fine, so I will be able to take legal action, and I will be challenging the fine. I don't think it's a reasonable response at all to what we did, and I don't think it's about safety. I think it's about whether anybody has the right to protest, and I think that there is a unsurprisingly desire from the government to stop people protesting.
And of course, this isn't an isolated incident, is it? I mean, there's been bus drivers on picket lines have had pressure applied to them. I mean, what are the implications of all of this on the right to protest?
One of the things that we said, and I said to the police and I said to the people in the square, is that we have a government whose management of the pandemic has led to 120,000, nearly 130,000 now deaths in Britain. Just them returning back to schools on the Monday, the day after my protest, 10 million people would be arriving at schools in crowds that would be 10 times the size of our protest, and they're deemed perfectly legal and perfectly safe. There's a budget that further enriches the rich and further impoverishes the poor. There's the test, track and trace that's still in the hands of Serco, who are completely incompetent and have failed. £37 billion spent on that, which interestingly, had they spent that on NHS wages, they could have given us a 15% pay rise for 25 years out of what they've spent on a failed test and trace mechanism. So it's not that the money's not there, it's what they're choosing to spend the money on. And I think the anger that exists about the way that they're choosing to spend the money, constantly looking to profits rather than to people, putting our, as health workers, lives at risk, putting the general population's life at risk, and continuing to do so. We wanted to protest about that, and the fact that you can't do that. We had 10,000 vacancies in the health service prior to the pandemic. We will have even more after the pandemic, because more and more health workers will think, I can't work at this sort of pace. People have died. We've had over 850 people died, and we think it's a lot higher than that, but they've stopped recording. We know lots and lots of health workers who've got long COVID and now are unlikely to return to work, certainly not in the role that they were doing prior. But also we have people who are absolutely exhausted, doing 2, 3, 4, 6 people people's jobs sometimes. So you'd have an intensive care nurse who used to look after one person, was looking after six, and doing it for days on end to cover sort of gaps in shift. We just haven't got enough healthcare because of 10 years of austerity. And that's not gone away. And unless the government invest in health workers and the health service, your health service and my health service is not going to be there when we need it. So when it comes to safety, we believe we were out there fighting for safety, and we were doing it in a safe way. And to say to the government, to say to me, you will be fined £10,000. I just think it's saying, I don't want you to protest about that. You know, you can send an email, you can have a Zoom meeting, but what you can't do is go and organise protests. And there's something fundamentally wrong about taking away what is our basic human right to be able to protest about the way the world is. I think there's something wrong, and I'm not surprised the government want to do it. I will want to do it if I were them, because they know they haven't got the support for the policies that they've got, that they're putting in. And I think it does have consequences if we allow them to get away with it.
So how can we fight back?
Well, I think we have to continue. I mean, you know, we have to continue to resist. I will be challenging it legally. I think the risk is that people will cancel protests or not organise them whilst they're waiting for that to happen. Meanwhile, the government do more and more dangerous things, whether it's on climate change or picket lines or sort of, you know, or general sort of, you know, health service or education or any of the other potential protests, racism that people could make at the moment. I think we have to challenge that, but I also think we have to challenge it by continuing to protest. I think we have to say we're not prepared to just sit at home and watch the world get worse, watch people become more and more distressed and paying a price when the system is continuing to pay people who have already got massive amounts of wealth more. So the fact that taxes for the rich and for businesses have been delayed, whereas cuts for ordinary working people, the pay freeze for everybody else is 0%, and somehow they said we should be grateful for 1%, and how Keir Starmer or Angela Rayner thinks 1.2% is going to satisfy us does astound me. And I think lots of health workers are very, very angry about the fact that they've come in at such a low level when you look at what we've asked for. 20% loss we've had in the last 10 years. And I think, you know, that the disparity between the scale of what they've charged, that they've paid for me. Somebody told me that, you know, if Dominic Cubbins had been fined £10,000 for his trip up to Durham, that would have been 3 months of his wage increase. My £10,000 fine, it will take me 56 years to pay using my 1%. And that's the gap between the way that penalties like that impact on rich people compared to poor people. Not one business has been fined in the whole of the pandemic, right, for any of the infractions that we know have taken place in the DVLA, in Jaguar, in loads and loads of workplaces where people have been told, come into work anyway, you know, don't tell anybody. And you just think, why is there such a difference between fining 2 people for going out with a cup of coffee in their hand or fining me for organising a very, very safe demonstration? What are the differences between that? And the differences is that I think they want to scapegoat and blame individuals for the pandemic rather than blaming themselves and their policies. And we have to have the right to protest, because otherwise it just carries on. Everyone keeps thinking, oh, it'll be all right by summer, it'll be all right by autumn, it'll be all right by Christmas. It's now March and it's not all right, and they're predicting 30 to 50,000 more deaths.
I mean, really important points there, not just about the health inequalities, but also the inequalities of justice that are just kind of highlighted by all of this. Karen, I wish we had more time to go into more detail. This has been really, really interesting, really useful. Do you have any final words for our viewers?
I would say don't be intimidated, right? Because if we are intimidated, then it might feel scary to do what we did, which is to organise protests. But if we don't organise protests, the world gets worse, much worse. And I don't want to hear any other health workers saying, you know, we've spent another shift and another 3 people have died, or another 5 people have died, or a colleague has died, or one of my relatives have died. We don't want more of that. We have to protest about the way the world is. And it isn't always easy. It's never been easy. But, you know, I think we have to hold our ground and continue to do that in a safe way, in the way that we did.
Karen, thank you again and good luck with everything.
Thank you very much.
So we've just heard from two frontline workers who, you know, they've seen, they've lived the degradation of the NHS. And well, Kathy, it's that quote from Chomsky, isn't it? You know, this is privatization 101. You run down the service, you run down the people until it falls apart, and then you sell it to your mates.
Yeah, pretty much. And that has been happening for longer than lots of people realise. I mean, if you go back to the very start of the NHS, the Conservative Party, who claim that they supported the formation of the NHS, absolutely did not. And every opportunity they have had since then, our NHS has been under attack by the Tories. This has ramped up recently. So, of course, there's 10 years of austerity measures overlaid on the Tory ideology of breaking up the NHS and, as you say, flogging it to their mates, along with what we've seen more recently, giving people contracts because they know them, not because they've had any experience of delivering what is needed to fight COVID. So, yes, absolutely spot on that Chomsky quote.
And you sort of, well, you touched on those contracts. One of those contracts, obviously, for test and trace. I mean, I said in the interview, they are absolutely balmy numbers. I mean, when you look at the New Zealand test and trace cost $250,000 New Zealand dollars, or £250,000, I think, in our terms, and worked, and ours cost 37 billion.
Yes.
And failed.
Yes, indeed. I mean, we talk about cronyism. It's actually corruption, I think. And for test and trace, that contract and all that money was given to a private company with an extremely poor performance record in everything else they've tried to do for the NHS. So although it was labelled NHS test and trace, it absolutely was not. It wasn't run by the NHS. And in Keep Our NHS Public, Oxfordshire, that I am a member of, we've looked at local test and trace and the importance of that. We've had a big campaign around it, and it was supported by our two local MPs. A cross-party council motion was carried, and has been carried in many parts of Oxfordshire, actually. So Keep Our NHS Public launched this and have been pushing for councils to adopt and support it. But of course, test and trace can't work because unless you have isolation. So if you test people, you trace them, you quickly tell them that they need to isolate, not 10 days later, not 2 weeks later, quickly. This is why we're asking for a local service. If people can't afford to self-isolate, then, the whole system has not worked.
And of course, the problem of statutory sick pay brings up a whole another set of inequalities.
Oh yes, you're right, absolutely right, Matt. This is about poverty and inequality. How can people afford to self-isolate if they, remember, 2 million people, mainly women, do not get any kind of sick pay, even though they're in work. So if you're on a 0 hours contract or part-time, you may not get any sick pay at all. So as a bit of a stop to that, I think, the government introduced this isolation payment of £500, which in itself, may not cover people's rent or food or bills, but it is there. So that sounds great on the face of it, but colleagues in Keep Our NHS Public have done some research about how these isolation payments have been working out. And across England, there are only 2 councils that have allocated 70% or more isolation payments to applicants. So what that means, for example, is that many, many councils are refusing a whole range of applications. We are looking into how they actually make those decisions. But in Oxford, only 10% of the applications for isolation support, only 10% have been so far allocated. 90% have been rejected. and we're looking into why that might be.
And obviously, you know, if people can't isolate, it's very difficult for them to do the responsible thing, and the disease spreads. I mean, we've already sort of seen it. Looks like the R rate might be inching back up.
Yeah,
with all the implications of that. And I think as well, obviously, the focus of this program has been about NHS pay, and justifiably so. I mean, it's an insulting offer of 1%, but of course. With regards to the NHS, I mean, the budget fell short in a number of other ways. Nothing about social care. I mean, workers in social care aren't even getting a measly 1%.
You know, this is underfunding. This is effectively cuts and cuts and cuts. We know so many people have said the NHS is in the most precarious position it has been since its foundation. And we went into the pandemic with the NHS in that parlous state. Unfortunately, I've seen statistics about, you know, people's faith in the NHS is reducing, which is a terrible shame. And that's why it's really important for programs like this to get people from the front line in, explaining what's going on, campaigners explaining, you know, that we are living that Noam Chomsky quote that you gave us. And if we're not careful, this government will succeed, and we will end up with an American insurance model, which means that unless you have comprehensive insurance, which costs a fortune, or private wealth, you know, we're going back to pre-1948 times.
And, you know, we mentioned it in the interview, but I think it's worth reiterating. In the United States, during the COVID crisis, the ongoing COVID crisis, so far, 500,000 people have declared what they call medical bankruptcy. That's becoming bankrupt because you can't pay your medical bills. I mean, and that's our future unless we stand up and fight. Kathy, really glad you could join us for this wrap up. Do you have any sort of final words for our viewers?
Well, we need to remember that a big issue that has arisen from the pandemic is about health inequality. Almost 2 million UK adults have lost at least a third of their income during the pandemic, with no resort to benefits or help of any kind. For test and trace to work, we need to support people to self-isolate, either by making sure they get the support payment that the government has brought in, and or fair and just statutory sick pay. And these things are completely interwoven. And absolutely necessary to keep control of the pandemic.
So there you have it. I mean, support the excellent comrades we had earlier on in the programme. Use the hashtag NHS Pay. Also look for content around the Full Sick Pay Now campaign. That also has a hashtag Full Sick Pay Now. Support Keep Our NHS Public. We'll put links to all of these campaigns and information you might need in the description of this video. And most importantly, do not go gentle into that good night. Watch Educate, Agitate, Organise every Saturday night. Kathy, thanks for joining me.
Thank you so much. Solidarity.